It's a big decision when you talk about having your hip replaced. And everybody needs to be comfortable that you're choosing the right doctor, the right approach, everything is right. I would go in asking questions about the different options, the anterior approach versus the posterior. We knew I was going to be the very first person using this table and this procedure in Shady Grove. So we had no history to turn into for past patients, how they had handled it. So that research was very, very important. And then the dialogue, the depth of the answers that we were getting, it was key. I felt very, very comfortable then that this is right for me. I was 100% confident, given my lifestyle, what I was trying to accomplish, that the approach was perfect. The table was going to be able to make this happen or make it possible to happen. I think the hospital prepared me very well. Dr. Durbhakula definitely prepared me for what it was going to be like. And the boot camp. We were able to ask some good questions in the boot camp, and there was a lot of good information every step of the way.
It's really important for people to come to total joint class so that they have a really, really good outcome. Fear is frightening. It actually can delay the healing process. Knowledge is wonderful. If people know what to expect from an experience, they seem to cope much better. Their pain is less. They get better faster.
Some of the things that I'm able to do now that I hadn't been able to do in quite some time in my life is activities that involve flexibility. 3 months after the surgery, I was strong enough to be able to get up with an actual backpack. It wasn't a month-long expedition, but it was a 4-day trip that you take a lot of equipment with you, and I was able to carry the full weight for the trip. And it was a lot of fun, mountainous, up and down, not flat. So it was pushing the recovery of the leg to the fullest and really stressing the hip joint, and I had no problems with the joint at all. I had been told it was going to be about a 12-month total recovery plan. I'm 4 months into it, and I think for me, I'm right where I should be. Maybe I'll never run a marathon, but being able to get up and run 2 to 10 miles, which is, half a marathon or something, this surgery has made a difference in my life in that it is giving back to me what I was losing. I had lost so much mobility in my hip and the ability to run that, and being a runner, it is giving back to me something I love.